I'm so happy to introduce Gretchen. Gretchen actually did family support coordinating before she transitioned into her new role as the hospital development coordinator. So Gretchen is going to do a presentation that has had an impact on organ donation. So Gretchen, I'll turn it over to you.
Thank you. My name is Gretchen, and I am a hospital development specialist. Okay. That's okay. So my main role is to educate in the hospital and to do presentations like this in different settings and to raise awareness and to help facilitate the donation process. I am working with Baptist in Forsyth out in Winston, and so it's an honor to be here today to speak with y'all. I also want to acknowledge at the beginning of this program that this is a very short time frame to talk about a really big and serious topic, and so I'm happy to field questions or to talk more after the presentation is over. And so with the growing rate of opioid use and abuse in our country, we all feel the effects of this epidemic. We feel it in the hospitals and in the community. In the emergency room, we see that critical moment of overdose, and in the ICUs, we see this epidemic taking lives. And across communities, we see this epidemic wreak havoc over families. Carolina Donor Services is also feeling the effect of opioid overdose. I want to talk with you just a little bit about the national picture of overdose deaths. In 2017, the 2018 and 19 data isn't validated yet, but over 70,000 people lost their lives to drug overdose and over 47,000 to opioids, specifically heroin. North Carolina has seen a really big increase in opioid overdose deaths over the last several years. The way these numbers break down is in the United States, every day 192 people lose their life from overdose. 130 of those from opioid. And in North Carolina, that's 6 people every day losing their life to opioid abuse and overdose. In North Carolina, this is called the opioid pyramid. And the biggest thing to understand from this pyramid is that deaths are the smallest tip of this really big burden of opioid overdose in our healthcare community and on the economy. And so the way these numbers break down is that one overdose death is equivalent to 2 hospital overdose visits, 4 ED overdose visits, 223 residents that are misusing pain meds, and over 3,000 prescriptions. So these are the ratios. So in 2018, there was 1,817 deaths in North Carolina from opioid overdose. And you can see how this spans out to affect our healthcare system and our communities. This is a heat map of North Carolina from this last year showing that these opioid overdose ED visits. And this includes intentional and accidental and unknown intent, but you can just see sort of different places in our state with the biggest burden. Switching back to national data, this is a chart that talks about the mechanism of death for all of the donors in our country. I want you to first look at the column for 2000. So this was 20 years ago. Mechanism of death was in huge proportion strokes. So that means almost half of the donors in the country were donors because of strokes. Switching gears to 20 years later, stroke care has increased, and so strokes are not, they're still sort of the leading mechanism of death for our donor patients, but they've gotten a lot better. Looking at cardiovascular, this switch from 5% of donors in 2000 to almost 20%. So heart disease has increased, our diets have gotten worse over the last 20 years. But I think the big one that I want to just point you to is from 2000, 1% of donors had a mechanism of death of overdose. And in 2019, close to 14%. It was a huge increase. But I want you to know that folks that abuse and use IV drugs can and do save lives. For CDS, our numbers reflect similarly to the national data. In 2018, almost 14% of our donors had a history of IV drug abuse, and in 2019, over 15%. And these are the number of organs that are able to be transplanted in the last 2 years from folks with IV drug abuse. I think there is a stigma about, can IV drug abusers be donors? I get this question all the time in the hospital. And the answer is yes, and they're actually very great organ donors. The average age is 25 to 34. And so just by the very nature of their age, these folks are otherwise very healthy apart from their addiction. They don't have a 20-year smoking history. They don't have a 20-year cardiac history, mostly because they didn't start smoking when they were 5 years old. And so the performance of the organs and the longevity of the organs that can come from folks who have abused drugs and have died from drugs is really amazing. I'm going to skip this one. I want to switch gears a little bit to some of the feelings that can be associated with death by overdose. As a family support coordinator for 5 years, I found that when I would talk with families about their loved one, if there was a death by overdose, the biggest thing that I heard from families is, I am feeling emotions that seem counterintuitive, or emotions that seem like I can't have both of these emotions at the same time. And so this, in 2017, Time Magazine published a special publication called Opioid Diaries. And this mom that's on your left is a mom whose daughter had passed from drugs, and she just said that the pain is deepest for the families of users whose lives are swept up in this cycle of fear and hope and shame and despair. And this quote continues, "I felt embarrassed, like what did I do? Even though she was drug addicted, she was so alive. She was funny, she was smart, she was a 5'1" dynamite." And I think that's what I find with all of the families that I work with. So I think the complex nature of grief that's associated with death by overdose is really unique when it presents itself. These emotions seem contradictory or inconsistent. You can feel sad and relief at the same time. So I'm going to talk with you about a couple different aspects of this unique type of grief. Some families can feel guilt. So what could I have done or should I have done different to prevent this death? If I had just let them come back in the house one more time. If I had not given them that money that they told me was for gas. These kinds of feelings can pop up. A sense of relief can also happen around death by overdose. When someone is an addict, no matter what type of addict, you pray and you hope for that suffering to end. And there is a natural sense of relief when that suffering ends. Obviously, no one ever prays for their person, their loved one to die. You hope that suffering would end through recovery. And sometimes that happens, and sometimes it happens over and over. But when a person passes, there can be a sense of relief that I don't have to wait for that phone call in the middle of the night to know what happened. And I don't have to have the family burden of having an addict. And feeling this sense of relief in no way diminishes a family's sense of loss or their love. Shame is another feeling that can be associated with death by overdose. And shame is about an emotion that you have about what other people think. And so there's a sense of, will people think if I did something wrong, or I could have done something different? Because of shame, there can also be blame. And research shows that survivors of when someone dies from overdose can have a higher incidence of blame. If you had only done this, if we had only done that. There's also fear and anxiety that sweeps in. And this can be about, will other people start using? Will other people relapse? Will other people overdose? And this can also create some mistrust amongst folks. And then stigma. Because of all of this, and just because of the general stigma about drug abuse in our country, there can be a reluctancy to openly discuss how and why this person died. What will people think? We want them to remember him as funny and smart and an athlete and not a drug addict. And because folks sometimes are less willing to share the cause of death, that can lead to isolation. And when you have this stigma and isolation, it can also stunt some grieving. But I want to tell you that not everyone is silent. These are folks from North Carolina that had published in their obituary that they died from overdose. And all of them tried in that message to say that you are not alone, that there is hope. These guys weren't all organ donors, but being able to share that message that they're not, that this addiction, that opioid overdose, opioid addiction, touches a lot of folks, and that in sharing that in their death is hopefully giving some other people hope. So that's a whole lot of information and sort of just scratching the surface on overdose and opioid abuse and drug use and donation. Other questions about that, or questions about, more specifically about donation and overdose?
Curious. I know that if you have a cancer or something, the recipient is told and given a choice.
Mm-hmm.
If a person has an addiction, is the recipient even aware of it? Recipient, I don't know.
Yeah, so that's a slide I skipped because I wasn't sure if I was going to have enough time. So there is, so an IV drug abuser's organs would be considered increased risk. But there can be a lot of things that equal increased risk. And so that could be that a person had spent some time in jail in the last year. It could be IV drug abuse, could be risky sexual behavior. Could also be that they just don't have an accurate historian. You know, if you'd ask my second cousin twice removed all about my medical social history, they would not know. And so that would make them increased risk. For folks who are on the receiving end, and we've got some recipient here, so you can maybe speak to this a little bit. When they're signing up and getting listed on the transplant waiting list, they can indicate whether they would want an increased risk organ or not. For me, I think about that if I needed a heart transplant or a lung transplant and I was near death, I don't really care.
I remember now, I signed, you know.
We'll take what you got and hopefully it's good.
Yeah. And I think the other thing that can play into this is for IV drug abusers specifically is risk of hepatitis. But what we're finding, and there's lots of studies that are published, that hepatitis can be treated and essentially gone with as little as 4 to 6 weeks of treatment.
I consented to a high-risk liver, and 2 weeks before my transplant, I was in the hospital with peritonitis for the third time, and I then signed a consent to accept a Hep C positive liver, knowing that 100% that I would get Hep C because it is curable now.
Yeah.
So yeah, but unless you sign those high-risk consents and the Hep C, they don't tell you really anything. And I didn't, obviously know until after I met my donor's family.
Yeah.
Of actually what happened.
Yeah.
But,
So you'd know it would be an increased organ, just not what's the definition of that increased risk.
Yeah,
And I
that's what I was trying to ask, was is it high risk?
So it technically is, just because of the chance of communicable diseases.
20-year-old, still a 20-year-old.
That's right. And a
Yeah.
20-year-old organ will give you an amazing longevity of life. But I think that's part of this, is where there's a really fine line in how much do you share and how much do you share to make sure there's transparency for that recipient, but at the same time protecting the donor's protected health information. So fine line.